So now we're going to move to the heart rate analysis of the systematic approach to analyzing these cardiovascular effects of autonomic drugs. So let's orient ourselves with this picture here. We have the SA node, that's the pacemaker, so that's the part of the heart that's going to be impacted by these drugs that's going to affect the heart rate. Now, we also have two channels that, just for review, the HCN or funny channels. These are mostly sodium channels that allow sodium to go through and depolarize the SA node during the spontaneous depolarization phase, phase 4. And also some calcium channels. We just put the L-type calcium channel here as an example of calcium coming in and also contributing to the phase 4 depolarization that is going to have an impact on the heart rate. Keep in mind, cyclic AMP, that's where this name HCN comes from. It's hyperpolarization, hyperpolarization activated, cyclic nucleotide gated. So cyclic AMP regulates this channel in a positive way. And also protein kinase A has a positive influence on the calcium channels through phosphorylation, affecting their open time and frequency of opening and things like that. So in the SA node then, it's the rate of depolarization that matters the most for the firing rate and the heart rate, and therefore the levels of cyclic AMP and pKa activity, that's going to ultimately dictate whether or not the heart rate is going to go up or down compared to the resting state. All right? What else do we have on this? We have the parasympathetic influences over here, with the preganglionic parasympathetic neurons releasing acetylcholine onto an NN receptor on the postganglionic parasympathetic neurons, which then release acetylcholine, which activates muscarinic type 2 receptors on the SA node. And those receptors, recall, are coupled to GI, which means they decrease cyclic AMP, and that would tend to lower the heart rate. The sympathetic nervous system, highlighted over here, preganglionic neurons release acetylcholine again onto NN receptors. Postganglionic sympathetic neurons get activated and they release norepinephrine from their nerve terminals, and that then acts on beta-1 adrenergic receptors, which are coupled to GS, the opposite G protein to the M2, which increases cyclic AMP, increases PK activity, and then that would cause an increased rate of depolarization, which would tend to raise the heart rate. So this is the parasympathetic-sympathetic antagonism, opposite effects on the heart rate, and it's through their signal transduction pathway going in the opposite direction. What I have also shown is there's more acetylcholine being released from preganglionic to postganglionic and postganglionic onto M2. So there's a lot of acetylcholine here compared to norepinephrine. That's to remind you that at rest, in most cases at rest, the parasympathetic system is the dominant part of the autonomic nervous system. So this is just showing you at the baseline, there's more parasympathetic activity than sympathetic activity, which means that the heart rate would be lower than the rate where there would be no autonomic influences. That is the intrinsic rate. So whatever our baseline that we're going to be showing where we start, we can assume that it's starting with a dominant parasympathetic division. So that's why there's less activity shown here with the less norepinephrine molecules compared to acetylcholine in the neuroeffector junction. All right. One other thing that I need to point out is the influence of mean arterial pressure on the autonomic nervous system. So I just simply highlighted the influences of the blood pressure. Blood pressure goes up. That activates the parasympathetic nervous system up here. That's through the baroreceptor stretch in the carotid sinus and aortic arch. They send their afferent information into the brainstem, and then that has an effect to increase the parasympathetic division. If the blood pressure goes up, it also has an effect to inhibit the sympathetic division. And that would be shown here by this negative sign. So this division would go down if blood pressure, for example, went up. If blood pressure goes down, it's the exact opposite. If the blood pressure falls, those baroreceptors are less stretched, and the parasympathetic system would be inhibited, and the sympathetic system would be activated. Okay, so the pluses and minuses are just to indicate directionality when blood pressure goes up or down. The reason why we want to have this in the picture is that we might see some cases where there's a drug and it happens to be acting on receptors on the SA node, and heart rate might go one direction in our mind, but then it has an effect also on the blood pressure, the mean arterial pressure, which will then have an opposite effect on the autonomic nervous system. And so those effects can be kind of confusing because we have, in that example, opposing effects, and then we have to reconcile what actually is happening. And in other cases, there might not be any effect of the drug on the SA node, but it might actually be affecting the blood pressure, and that would then explain the changes in heart rate. So it's good to have this in our mental model for how to think about the different effects of drugs. And then what we're going to do is consider at this step 4, after we've looked at the mean arterial pressure changes and anticipated what direction it would go, look at, is the drug affecting any of the autonomic receptors on the SA node, and we just combine them together in our mind and say, well, what is the effect of these two things? Is one going to win over the other? In general, the baroreceptor reflex effects tend to beat out any direct effects in the examples that we go over, because most of the changes that we see are big changes in the mean arterial pressure, big enough where the baroreceptor reflex response is a robust response. If the mean arterial pressure happens to not change very much, changes are modest, that might mean that the direct effect, if there is one, could beat out an indirect effect through the baroreceptor reflex. So we have to kind of discuss these considerations as we go through specific examples of drugs. And that's what we're going to do next.